best dentist in Los Angeles, talks to you about anesthesia. The biggest apprehension patients have when visiting the dentist is the fear of pain. Even simple fillings of teeth can be very painful. Years ago, this may have been a powerful deterrent from visiting the dentist. With modern advancements, pain is virtually a thing of the past when getting dental work done. There are some procedures that would be almost impossible to do without at least numbing the affected area. Can anyone imagine a root canal these days without anesthesia? There are those people who even dread getting their teeth cleaned for fear of being hurt. Your best dentist in Los Angeles may be aware of your phobia and suggest some medication for you to take before your visit. This is to calm you and get you more relaxed for a much more productive visit. Types of anesthesia. Anesthesia comes in the form of local anesthesia or general anesthesia. Local anesthesia is quick acting and applied with a cotton swab to numb an area of injection prior to being injected. The solution that is being injected to block the nerves in the area to be worked on is also a local anesthesia because the patient is fully conscious. It wears off within a couple of hours. General anesthesia is reserved for more difficult and invasive procedures. Because general anesthesia will bring a person into a state of unconsciousness, there is always a greater risk of some unforeseen and unwanted reaction taking place. Certain patients who have problems with uncontrollable body movements may benefit from general anesthesia. Your best dentist in Los Angeles can provide you with answers to any questions in this regard. Pre-anesthesia. Before giving a patient any type of anesthesia, several parameters will have to be established. The best dentist in Los Angeles will have to know the medical history of the patient. Most of this information can be found in the questionnaire every new patient completes. Particular attention is directed to the areas of allergies. Some people are very hypersensitive to some proponents of anesthesia. The overall health must be thoroughly evaluated. For instance, elderly patients with heart disease will probably have to be given a different anesthesia than a healthy 20-year-old. The amount of anesthesia to be given depends on many factors as well. Body weight is one of them. This is of particular concern with children who are often just a fraction of the weight of an adult. Post-anesthesia. After the best dentist in Los Angeles has completed the procedure using general anesthesia, his job is not finished. He must still monitor his patient for any kind of spiking heart rate or temperature. He must protect his patient against possible infection by loading him or her up with a suitable antibiotic. He will have to watch closely for any kind of reaction and take measures to treat the reaction or complication. It is vital to have the patient rest in the recovery room long enough to be coherent before being taken home. This time is needed again for monitoring the patient's progress and let the anesthesia wear off.